And so the County of Sonoma shared with us this note. It says, in regards to vaccine distribution, today, 80% of the county's eligible population residents are fully vaccinated, with an additional 7.8% of residents partially vaccinated. That means that 87% of our eligible population is fully or partially vaccinated. 61.8% of the county's eligible population have received boosters. Breakthrough cases in vaccine people tend to be mild or asymptomatic. Unvaccinated people are at a far greater chance of, again, ending up in the hospital. That means people who are unvaccinated in our county are 17.6% times more likely to be hospitalized if they get COVID, and they are 12.8 times more likely to die from COVID. In regards to our metrics, it says that our rate of new daily cases per 100,000 individuals is 77. And so it's important that we compare that with, again, our case rate for unvaccinated individuals, which is 161 per 100,000. And so it's really important that we take care of this, that we get ourselves tested, that we get ourselves vaccinated. And our overall testing positivity rate is 13.3%. In regards to the status of the orders related to masking, with COVID-19 cases and hospitalizations declining, Sonoma County Health Officer Dr. Sandari Mays confirmed Tuesday that a local health order restricting the size of large gatherings will expire as scheduled at 11:59 p.m. Thursday, February 10th, that is today. And on January 12th, Dr. Mays placed limits on the size of indoor and outdoor gatherings for 30 days in an attempt to prevent super spreader events as COVID cases soar to unprecedented levels in Sonoma County. So that order, again, will end today. It is important, again, for individuals to keep in mind that because there's going to be also change in masking rules at the state level, then locally, again, restaurants and other businesses will soon be able to, people will be able to walk in there without masks. And as a result of that, individuals, it may lead to an increase in the number of people who end up positive. So again, just because suddenly they're saying that masks are not required, especially people who have chronic conditions should definitely consider whether or not they should go into restaurants and other businesses without their masks, or ask individuals to go in and take care of those tasks for them. In regards to local rates, there were 66 COVID-related hospitalizations in the county as of Tuesday. 15 of those COVID patients were in the ICU beds. There have been 39 COVID-related deaths since December 1st, with 31 reported so far in January and 1 in February. Since December, 1.98% of the local deaths have been people ages 65 and older. 98% were unvaccinated, partially vaccinated, or not up to date with their vaccines. 92% had underlying conditions. County residents 65 and older have accounted for 74% of the 455 COVID-related deaths during the pandemic. Deaths typically lag hospitalizations by a month or more. The county is expanding access to pediatric and adult COVID-19 vaccines and boosters through large weekend clinics at the Sonoma County Fairgrounds. Clinics will be on Saturday and Sunday, the next 2 weekends from 9 a.m. until 4 p.m. in the Garrett building. The clinics are open to everyone in the community. Vaccines are free. The clinics are open to all, and proof of citizenship status is not required. Just 31% of children ages 5 to 11 are fully vaccinated. Additionally, only 62% of eligible population is both fully vaccinated and boosted. Again, California again requires paid sick leave for COVID. So Governor Gavin Newsom today signed a law requiring many companies to give workers up to 2 weeks of paid time off if they get sick from the coronavirus. The bill, which is effective immediately and retroactive to January 1st, and applies to companies with 26 or more employees. It expires September 30th of 2022. At the start of the pandemic, state and federal laws require most employers to give workers paid time off for COVID. Many laws expire as more people get vaccinated and cases decline. California law expired last September. Senate Bill 114 gives workers up to 1 week of paid time off if they get the coronavirus or are caring for a sick family member. They can get a second week off only if they or their family members test positive. If the employee doesn't take a test or refuses to provide results, the employer doesn't have to grant them another 40 hours of leave. Employers must pay for and provide the test. Workers can use the 40 hours of paid leave for a swath of COVID-19 related reasons, including COVID-19 symptoms, vaccine appointments, or caring for a family member with COVID-19, or a child whose school or place of care is closed due to COVID-19. Part-time employees are eligible at a rate commensurate to their hours typically worked. And finally, nearly 25 million in direct assistance has been provided to more than 2,100 Sonoma County households through the Sonoma County Emergency Rental Assistance Program. Additionally, more than 4,000 applications are in the process, and these applications are expected to deplete the rest of the nearly 40 million in rental assistance funds allocated to Sonoma County. As a result, beginning February 11th, that is tomorrow, there will be a pause in accepting new applications for the Emergency Rental Assistance Program, which is funded by the state of California and the federal government. The pause is necessary to try and ensure that all those who completed applications and that are being processed now receive the funds they requested. If more funds are needed, the county can claim a portion of the reallocated funds to other jurisdictions if the state or federal government announces a relocation. The program has helped 2,154 households. Applications submitted before the pause date, which is February 11th, will be reviewed and allocated as remaining funds allowed. Beginning October 1st, 2021, tenants who have submitted a completed application are protected from eviction for non-payment of rent due between October 1st and March 30th of 2022 until there is any other changes. So for now, that is when the protections are going to be available. And the last comment here is that we, Líderes del Futuro, Humanidad, Therapy and Educational Programs, and other organizations like Mecha de SRJC, Latinx Student Congress, and others will be working tomorrow to bag some of the 20,000 masks that we received from the state of California. On Saturday from 2 until 4 p.m., we are going to give out masks, and we are going to be from 2 to 4 p.m. We're going to be at 1260 North Dutton Avenue in Santa Rosa, and we are going to be giving out masks as a drive-through situation. And so the community is invited in order to participate at this event, here in Santa Rosa, 1260 North Dutton in Santa Rosa. We have surgical masks and we have KN95. And so with that, it is important that the community please share that information with other individuals. That way everybody can benefit. We are okay if we end up running out of masks. We are packaging 10 masks per bag. We are also going to add a little bit of information from Santa Rosa Junior College and a little bit of information from other resources. And so with that, we want to make sure that the community is aware that there are resources available for everyone. So we invite you to, again, keep that in mind. 1260 North Dutton Avenue in Santa Rosa, Saturday from 2 until 4 p.m. We are next to the Santa Rosa Health Clinic that is on Dutton Avenue. And with that, we're going to take a second and we'll be back with you for more information.